One of the factors that comes up a lot with mental health is what would prompt someone to seek out treatment? Is it that they're experiencing distress associated with their symptoms? What if it's their partner? What if it's impacting their workplace? What if it's impacting other relationships? Being able to identify the role of what we call like subjective distress is a really important factor when you're working with individuals. You are developing an understanding of their experience. And this is also where you as a clinician want to be aware of what your own biases, your own distress levels, your own reactions to the stimuli. So for example, if you have someone who may be experiencing high levels of subjective, that means their own personal distress associated with compulsive behaviors associated with OCD, that would be an indication of where we can see symptom is leading to subjective distress. But what happens if we say, well, this symptom, or let's say this compulsive behavior, isn't causing subjective distress to the person because it's actually reducing their anxiety, but the level of intensity or the level of frequency of that compulsive behavior is causing a high level of subjective distress in their romantic partner. How do we balance that? Being able to look at the definition of whom is getting impacted by the symptom. So when we're working with patients, it's being able to look at holding space for both the subjective distress that is being caused, as well as in what ways is that symptom or that behavior impacting the world around them. Being able to look, is there an impact? And even for clinicians, this is something super important to keep into consideration. If a person is describing a particular pattern of behavior that you notice yourself experiencing distress associated with that behavior, not judging them, not saying, well, you really shouldn't do that just because you're having reactions. That's where it's a little bit like rolling an insight check on yourself as a clinician. Roll that dice and being able to pause and going, am I having a reaction because of something about me? Or am I having a reaction to the fact that this person is experiencing such high levels of distress, but they don't seem to notice the impact, or they're not really computing the impact that that is having on their day-to-day functioning? That may not be identifying the impact that pattern of behavior is having on their sleeping, their eating, their sexual functioning, their ability to hang out with friends. That is part of our job as clinicians, is to identify that our patient is experiencing both subjective distress and are there objective influences on their symptoms. If so, what are they? This is where having a clinician in your life is honestly a little bit more helpful than going to therapy for your friend or going to your friends for therapy, is because they have their own subjective bias. They have their own biases towards you. They might have their own protective patterns. They may not be in a space to identify and holding that space at those different levels of subjective distress, up the levels, up the levels, up the levels, and looking at it from a bit more of a macro perspective. That is where us as clinicians can really come in, is to look at the different levels that this pattern of behavior might be impacting a person, and then being able to collaboratively work with the person to determine, would they like that to be different in their life? Would they want things to be different in their life, living into their values, living into their goals, their values? We call it the ego-syntonic experiences for them. That's why it's really important for us as clinicians to be aware of our own biases, to be aware of, are there patterns that we are more attuned with? It should be no one's surprise that I am super attuned to anxiety, trauma, and sexual health and functioning concerns because of my specialization. It's really important that I recognize that that is going to be a bias that I have. I'm going to ask about those patterns of behavior. To some patients, they may not have any distress associated with it. Awesome, but I sure as heck am going to ask about it. That is one of the biggest goals of my role as a clinician, is to make that be a collaborative experience together, instead of me just sitting there being like, well, you should do this and you should do that. If you have a clinician who's doing that, please don't. Please fire.